So today I'm doing a goniometer screening assessment on my brother Jonathan. So he's gonna be my patient today. So, all right, Jonathan. So first one we're gonna do, have you lay flat all the way on the table. All right. So this one's gonna be for hip extension. So I'm gonna first ask Jonathan to lift his leg up into so bringing your leg straight up into the air. So keeping your knee and leg straight the whole time. Perfect. So I'm gonna guesstimate here. Trying to keep his hip from coming up too high. You can relax your hip. So make sure that hip stays flat on the table. So bringing that hip up again, most likely about 10 to 15 degrees. Normal is about 20 degrees. Goniometer, greater trochanter, midline of the trunk, and then mid shaft of the femur with the lateral epicondyle as the reference point. You can go ahead and lift your leg up now. Here. Hip for me. And then relax. So here's about 14 degrees here. We'll roll to the other side, do the same exact thing. So you can do the same exact motion on this side for me. Relax the hip just a little bit. This one's about, relax for me. This one is about 12 on this angle. So what I'm gonna have you do now is shoulder extension. So have you slide towards the edge of the table for me. So you have the patient turn the head away. Arm is gonna come up into extension. So you reach your arm, relax your forearm. So just you bring your elbow straight up and your arm stays relaxed. All right. So here you're looking for that extension motion. Probably you're looking for about 6 degrees as your norm value. You can relax. Here is probably about 50 degrees. So now what I have him do is just kind of measure, go again for me, Jonathan. And relax for me. So here I got 51 for the left arm, and then sorry, I'm gonna have you switch to the other side.
Okay.
All right, this table is a little bigger than normal plinth.
Do the same thing?
Yeah, do the same thing. And then fulcrum that lateral aspect of the humeral head, shaft of the humerus. Relax the arm. You can relax now. This one is right at 50 degrees. Okay. So now John, I'll have you lay on your back for me. Okay. Then I'm going to roll over onto his back. The first measurement that we're going to get is hip flexion. So same thing as extension, greater trochanter, midline of trunk, and lateral shaft of the femur. What I'll have you do is bring your knee towards your chest for me, okay? So you can go ahead and do that with your knee relaxed. So you'll notice how tight he comes up into, so we're gonna kind of let him relax here. So right there, it's probably about 90 degrees. Normal is gonna be about 120. He got 95. Relax. Go ahead and do the other side.
Okay.
Same thing on this side. This will be a firm infill. Just a little bit. (92) on this end, all right? And then actually what I'll do, we're gonna go into knee flexion. So this will be a soft infill. Norm's gonna be about 30 degrees. So this one, lateral epicondyle of the femur, standing arm, lateral shaft of the fibula, of the femur, going down to the greater trochanter as reference. And then moving arm is with the shaft of the tibia. So kind of assessing motion kind of all the way through, making sure you're at 0, and then do that same exact motion again for me. Wonderful. And then he's actually right about norm, 31, 32 degrees. All right, you can relax that leg for me. And then same thing on the other side. 30 degrees. Yeah, right about 30 degrees, okay. So next what we'll do is hip abductions. I'm coming to the other side of the table. Hip abduction fulcrum is going to be at the ASIS of the testing leg, imaginary line with the stationary arm, and then the moving arm is going to be with the anterior shaft of the femur. What I'll have you do, Jonathan, is shift a little bit to the left of the table. Norms are going to be 40 to 55 degrees with this. So what I have you do, Jonathan, is keeping your toes pointed straight up, move your leg out to the side for me. Alright, find you. Good. You'll notice his foot kind of comes in like this. So we really want to make sure his toes stay pointed straight up. And then you can relax for me. Here is 40 degrees. 40 degrees for the right, and then same thing other side. Sorry, actually, let me do keep going, because now you're gonna have room shift a little bit that way. Okay. All right, same thing again, moving that leg out to the side. Relax for me. So that one's about 35 degrees with that range of motion. So then what I'll have him do is I'm going to have him shift his legs over, shift one leg over, the one that's not being tested, same position with adduction. And then what I'll have you do is bring this leg straight towards this other leg. So you probably will be prohibited a little bit from moving it further over. Position's right, so exact same setup in terms of the goniometer. So you can go ahead and move the leg for me. This one's going to be about 20 to 25 degrees of your normalcy, and he's right at 24, 25 degrees. And then we'll go back and test the other leg. I'm going to shift the other leg out of the way. Here. I'll shift the chest a little bit more. Same thing on this one. This one might be a soft, might be a firm infill, depending on how much range of motion they have. So you can go ahead and move that leg towards this way for me. And then relax for me. So that was about 21, 22 degrees there. Okay. So I have to position like that. Inflection, extension. Let me get this other one. So next what we'll do is shoulder complex range of motion. Where I'll have you slide towards the end of the table a little bit more. I'm sorry, I moved you over too far. So slide back a little bit more. So what you'll do is you'll bring, patient brings their arm out to the side. It's a little tight. So arm supported, try to relax that shoulder as best you can. You're going to bring him up. Oh God. Oh no. So, ideally you're going to start fulcrum here. Left arm process, standing arm perpendicular, arms here. Norm's going to be about 70 degrees. So I'm going to bring him here. Start from neutral. I'm sorry, and my guesstimation for this would probably be almost 80, almost 90 degrees. And he's got about 73 degrees. And then we'll go external rotation, so we're just going to go the opposite direction. So coming 90, and then going back, you can see kind of that chest rising up as we come here. So he's pretty limited in terms of external rotation. So I would guess about 70 degrees. Gonna go here. Norms for this are gonna be about 90. So here he's actually about 63 degrees. So pretty limited in terms of that range of motion. And then we're gonna go shoulder abduction while we're on this side. So I'll just keep the towel underneath his arm. So we're gonna bring your arm all the way up to the side for me. So he gets probably about 150. So axis is going to be at the acromion AC joint, acromion process, standing arm shaft of the midline of the trunk or parallel to the sternum, and then the moving arm is going to be in line with the shaft of the humerus. So here you can go ahead and relax for him. So norms here are going to be about 180, but his right there was about 147. All right, so we got those, and then what I'll do is shift over this way. We'll do the exact same things, internal, external, and then abduction. Okay, so actually we'll do abduction first, since you're over here. Keep that thumb pointed up. Good. So again, probably about 150. And it's 147 for abduction. And then, I'm sorry, just slide back over just that way. So we're gonna do those first two that we did before. Putting that arm here on the side of the table. Out like this. Does that feel comfortable there?
Mm-hmm.
And then we're gonna move into internal rotation. Arm shoulders good. And that was about 62. So that external rotation is actually good. It's about 96, 97, so that one's good. So he used to throw a little bit back in the day. You were a stud baseball player, weren't you?
Not at all.
Okay, relax that one there. The extension, abduction, rotation, legs, neck, finger, flexion. So next one we'll do is elbow flexion. So arms will be here on the side. Standing arm in line with the, you just kind of relax your arm, supinated. And then out at the lateral epicondyle of the humerus, standing arm, humerus, shaft of the humerus, and then moving arm, shaft of the radius, ulnar, at the ulnar styloid process here. Norm's gonna be about 150 for this one. So go ahead and do the motion, doing like a bicep curl. Good. Here, probably gonna guess about 140. And it's 145, so we're very close to that norm. All right, we'll go ahead and do that on the other side real quick. Same exact thing, same exact measurements, or alignments. And then go ahead and do the motion. And 145 as well, so almost the exact same on both sides, okay? All right, so next one, we have the lids down. All right, so what I'm gonna have you do now is sit with your feet hanging off the table for me.
Okay.
All right, wonderful. Make sure he's got some long legs. Make sure his feet are coming off. So what I would do, actually no, I'm gonna do that. So I'm gonna have you put this underneath your left leg.
Okay.
All right. So next we're gonna do internal and external rotation of the hip. So fulcrum. Mid patella, moving arm, shaft of the patella, shaft of the tibia, fibula, and then standing arm is just perpendicular to the ground. Jonathan was a W sitter, so he is going to have a lot more internal rotation than external rotation. So norms for both internal and external rotation are going to be about 45 degrees. Sorry, I'm doing the wrong leg. Dummy. Yeah. Right, so here. And I'm getting 50 degrees for the right leg, and then we'll slide this leg just a little bit over there for me. Same exact setup for external rotation. And then you're going to bring your leg towards the inside. So you notice very much of a decrease here. So I'm getting not much at all. If I were to push more, I might be able to get to 15 degrees. But he's very stiff, very limited with that. 45 degrees is going to be the norm again for that one. So I'm going to have you switch this one real quick again underneath that arm, underneath that leg. Same thing, come out the side. This one's about 45, almost 45. And then shift that leg over a little bit for it. And then bring your foot in towards the side. So again, pretty limited. This one's actually about 20, 22 here. So we got a little bit more movement there. All right. So next motion we're going to go with ankle plantar flexion and dorsiflexion. So for these, norms are going to be about 50 for plantar flexion. Make sure you can see me in here. Oh no. Yeah. Let me pull it down. Okay. All right. So norms for these are going to be about 50 degrees for plantar flexion, 20 degrees for dorsiflexion. All right. So lateral epicondyle, fulcrum, shaft of the tibia, fibula, and then in line with the metatarsal phalangeal joint. So making sure it starts at neutral. Here, so dorsiflexion, pull your toes up to your face. And then it's going to be about 5-10 degrees. And then we'll go pointing your toes down. So for this one, this one is going to be about 10, 15, 20, 25, 30. That's about 55 for that one. All right. We'll rotate around to the other side. Same exact landmarks. So here, getting into neutral, toes. All right, I'll bring your toes up towards your face. Not a lot of movement with this one either. I'm getting about 5 degrees with this one. And now point your toes down to the floor. Both of these infills are going to be firm. You can relax the foot. This one is 50 as well. All right, so next we're going to go to ankle inversion and eversion. So set up like this here. So what you're going to do is bring your foot towards the inside like this, like you're trying to scoop that. Yep, exactly. So here, we'll guesstimate about, not a lot of inversion there. Bring it back to neutral for me. I'd say about 10 to 15 degrees for inversion, and then do eversion for me. Whoop. So I want to make sure you try to just move your toes. Yeah, there you go. Eversion looks pretty good. I'd say about 20 degrees there. All right, so bring your foot back in. Sorry. Fulcrum in between both the malleoli. Moving arm with the second metatarsal, and then standing arm up here with the tibia and fibula. Alright, so bring those toes in for me. Bring your foot in. This one's about 18 degrees. And then go the other way for me. 18, and he's got about 18, almost 20 with this one. So 15 is going to be normal for E version, 35 for N version. Okay, same setup on the other side. Alright, same thing, bring those toes in. I'm sorry, go back again for me. Alright, go again. That one's about 30 on that one. And go back. And go the other way. This one's about 16 degrees for E version there. So next what we'll do is great toe extension. Where's my little guy? Alright, so great toe extension, so you bring your toes up. Bring your toes up. You kind of relax your foot there. Norm is going to be about 70 for extension, 45 for flexion. So first one, gold standard would be on the dorsum of the foot, but I don't have the best goniometer for that, so I'm going to do lateral to the foot. So MTP joint fulcrum, standing arm, phalange, standing arm, non-moving arm is going to be in line with the metatarsal phalangeal joint, or the metatarsals. All right, so you can bring your toe up for me, John. Here we have not quite 40, 38 degrees. So now you can go bring your toes down. So leave your foot like this.
Yep.
There you go, perfect. So here, probably gonna be about 20, 30 degrees. Relax your foot real quick. I'm gonna go ahead and do it one more time. This one's 30 degrees, almost exactly for that one. And then we'll go ahead and go to the other side. Same exact measurement coming out laterally. So we're gonna do toes up first. I'm gonna say about 40, maybe 45 on this one. This one's well, about 38 for this one, and then what you'll do again, toes coming down. This one looks a little bit more limited. Try to bring your toes up just a little. So try to keep that foot just like that, and then you just want to scurl. Try not to move the ankle at all. Good. Probably about 20. I'd probably say 25 degrees here. Actually getting 32, 33 degrees for there. All right, so good flexion, extension, and flexion. All right, so what I'm gonna have you do now is I'm gonna have you sit on the edge of the table, so you can hop off the table real quick, and then your hand is gonna go towards the far side over here. I'm gonna get you in this chair. These next couple are going to be for the wrists. All right, so actually let's leave your hand off just for the first one. This first one we're gonna do is forearm supination. So you're gonna have your hand elbow tight against your side, hand up off your thigh so that you can have a little freedom of movement. So just gonna have him open up his hand, standing arm, perpendicular to the ground. Moving arm is going to be in line with the creases in the wrist, and it's going to follow him. It's going to free float off the top, and then the fulcrum is going to be at the ulnar styloid process medially. Okay, so I'm going to watch him move the wrist. So you kind of open it up like this for me. Looks pretty good. No compensations at all. I'm going to guess about 80, maybe not 85. So I go here, right at 85. Perfect. And then we're gonna go pronation. So pretty much the exact same layout, but I'm gonna go on the dorsum of the hand. All right, so same exact layout, perpendicular. Hand's gonna go this way, so you're gonna roll this way with your wrist. Okay, go ahead and do that for me. So that one was probably, from my guess, I'd guess about 80. This one is 85, again, right at 85, so really good. So we'll go ahead and go on this arm. So start the hand up like this, perfect. And then roll your hand out for me. This one is 88. And then I'll go relax your hand. And then same thing. And then roll your hand in for me. Good, and that one's 86. All right, so pretty close to the norms there. Those are both gonna be some firm infills for both of those movements. So now I'm gonna have you slide forward a little bit in the chair and have your wrist as it's hanging off the table, okay? So this is gonna be wrist flexion and extension. So you're gonna be able, positions fulcrum, medial side, triquetrum, moving standing arm in line with ulna and radius, and then other arm in line with the fifth metacarpal. So John, you're gonna bring your wrist up like this. Norm's gonna be about 70 degrees for extension. And you can kind of relax your fingers. So you kind of just let them drop. There you go. Coming all the way up for me as far as you can. So this one's actually about 50 degrees. And then what I'll have you do is go down this way for me. Slide a little bit forward for me. Sorry, I don't want to make sure you're not prevented from being able to move. This one is probably about 70 degrees. For this one, it's going to be again firm infill along with extension. It's going to be 65. 65 for that one, okay? Next, we'll do ulnar and radial deviation. So slide your hand back. Hand goes all the way flat on the table. Arms go with radial and ulnar. Fulcrum, capitate, and then moving arm with the third metacarpal. So John, what you're going to do is move your wrist towards your thumb. Okay. This radial deviation is going to be about 20 degrees. You can go ahead and do that now. This motion looks right about 20 degrees. And he's at 22. So now you're gonna go this way. Ulnar deviation. So go this way for me. Standard is gonna be about 30. And I would guesstimate about 30 based off the look of that again. Both those wrist motion looks really good. This one's 35. 36 degrees for that one. And then what we'll do, next we'll go into MCP flexion. So this next one, what I'll have him do, so I'm gonna try to do the gold standard way with this crazy goniometer. It's really long. So fulcrum's gonna go on top, free floating outside the MCP joint. Hands gonna be neutral. Arms are gonna be in line with the proximal phalanges, and then other arm is gonna be in line with the dorsum of the palm, or dorsum of the hand. So here, John, what you're gonna do is you're gonna kind of bring your finger in like this. You're almost like making a fist. Okay. Bring it on in for me. Bring them all. So bring. This is the main. There you go. Norms are gonna be about 90 for this. John is at 75, 76 here. Okay. And come back out of this one. And then what we'll do for extension, same exact landmarks. So you're gonna try to bring your finger back with this finger, with this part of the finger relax. So it's gonna look like that. So you're not gonna be moving as much with the tips of these fingers, but it's just gonna be movement here. Okay. So like that.
Okay. Got it.
this one, norms for extension are going to be about 45 degrees. What I'm going to do with this, because it's a little hard with how long it is, just relax the tips of these and just let it come back like this. He's getting about 30 degrees of MCP extension. Norm's going to be about 45 degrees. Next we're going to go PIP flexion and extension, so you're just going to bring this finger in like this. Norm's going to be about 100 firm infill. I would guess about actually 110 for this one. So go back up like that. Come on in. Oop. Get this. John actually has about 120 for this range of motion, and then what you can do, extend your finger out as far as you can. I'm sorry, put it here. So for this one, he's right at 0 for PIP extension. So fulcrum is going to be PIP joint, lateral PIP joint. Moving arm is going to be in line with the distal phalange, and then standing arm is going to be in line with the proximal phalange. So next we're going to do opposition. So rotate your hand like this for me, make it flat on the table. Like this, so try to make it as flat as you can. Is that uncomfortable for you?
This is just about as flat as I can go.
Okay, so basically what we're looking for is trying to bring your thumb all the way across into touching that part.
Okay.
So for this, bring it over again. So you want to keep that finger straight like that the entire time.
Okay.
So relax that for me. So he gets his finger pretty much all the way down towards the table. Okay, so all right. So let's rotate now. So let's rotate and have you turn the chair and face this way for me.
Okay.
I think I should just have it hanging off diagonally.
Okay.
That'll work fine. To the pronation, and then roll it over like this for me.
Okay.
And then have it a little further off.
Okay.
All right. So here, I'm gonna measure flexion. A little further forward. So here we're gonna go flexion. Flexion is about 80, 82. Then extension, about 50 here, okay? And then having your hand flat on the table, straight arm straight out for me. And come this way.
So which way?
So cup towards your thumb.
Okay.
About 30 for radial deviation, and then come this way for me towards your pinky. All right, there you go. And then this one is about 42, 43. Okay, and then I'll rotate to flipping your hand over. So MCP flexion and extension again. So try to move here. You're gonna bring that finger in like this for me, like this. Move it there. There you go. This one's about 90, just from the looks of it. It's got right at 90, and come into extension for me. So extend that finger back. You can kind of relax the tip of the finger. And this one's about 10. That one's about 40, 45. I'm sorry. That was about 130. about 40. And then we'll do PIP. So you just bring in your finger in like this for me. That one looks about probably 110, 115. Bring it all the way in for me again. Right at 110, perfect. And then now straighten that finger back out. It's got a little bit of extension here, so about 6 degrees of extension with that one. All right, that was it. This one. So next we will do standing up. Okay. So what I'll have you do is face the that wall for me.
Okay.
Let me get a pin. So for this, we're going to do, do you have to take a shirt?
Oh yeah.
So for this, we're going to find the C7 and T12. So we're going to mark each spots. Let me rotate to the right and to the left for me. Rotate again. And a bit forward for me. It's not marked. Right there. Alright, and you can come back up for me.
Okay.
And then T12, mark both spots. That one works, marked. I have to do some math with this one. So measuring tape all the way up to 34. What I'm gonna do is bend forward and reach for your toes. And try to measure it, and then we'll have to do some math with it. That's as far as you can go. All right, so he doesn't have a lot, so it went from 34 to 36. So that was that would be under the norms of 10 centimeters. You can come back up for me. All right, so same exact measurements for extension now. So what I'm gonna have you do is you're gonna put your hands on your hips,
Okay.
and you're going to lean back towards me. Okay.
Okay.
As far as you can go. As far as
Yep.
So we're about in the exact same spot. Go back and straighten out for me. That all the way straight. So it's about half a centimeter for that movement. Okay. Next, what we'll do? Have you come around the other side of the table for me? Sorry.
That's fine.
So for next one, we will do lateral flexion. So what we'll do is just kind of like put your hands and roll your hand like just up slightly, and put your hand straight down like you're normally. Jonathan's got extra long arms, so mark one spot and you're just gonna kind of rotate, try to reach your hand as far down your leg as you can.
Okay.
As far as you can go. Okay. Good. Mark it and relax for me.
Okay.
So I'm gonna measure those two. And it's 17 and a half. Norm is going to be about 22 centimeters. So he's close to the norm. Firm end feel for this one. The ribs are going to kind of get scrunched get scrunched on the side of the hip. Same thing on this side. And then come on down for me. As far as you can go. Good. All right, the next one. This one is 16 and a half centimeters, all right? So a little bit less on the right side. And then the next one, what we'll do is pretty much find S2 and then go 15 centimeters up. So we're gonna do the lumbar flexion and extension. So come on this side, find iliac crest, roll over. And then measure 15 centimeters up. A little bit above our marks. What I want you to do, slide back towards me a little bit so you don't hit your face on the table.
Okay.
And then reach forward and touch your toes again. And 12, 12 to 17, so about the 5 centimeter change there. That's pretty good. Stand up for me. And then come into extension again. So come and put your hands on your hips and lean back towards me like you're about to tumble on over. And then this one is 10 centimeters here, okay? Other things I forgot to do. So I'm gonna have you sit back in the chair for me real quick.
Okay.
And I'm gonna measure some of your neck and your neck range of motion. So cervical extension, flexion, lateral flexion are all gonna be about 45 degrees, and thoracic rotation are gonna all be 45 degrees as the norm. So for this, I'm gonna do cervical rotation. Standing arm is gonna be in line with the AC joint. Moving arm is gonna be in line with the nose, fulcrum, top of the head. Firm infill as you're gonna bring your nose, like bring your chin towards the right side. Sorry, no, so bring your head up for me.
Okay.
He has got 72 for that one. Good. So 60 is going to be the norm for this one. So he's a little bit over. So same thing on the left side though. Make sure we're all lined up. And that one's 70. All right. So next one I'm gonna have you do is we're gonna, like you were doing before, we're gonna bring your head forward, but as when I tell you to. So fulcrum, external auditory meatus, standing arm straight up perpendicular. Other arm is gonna be in line with the nose. So now you can bring your nose towards your, bring your nose like you're looking down at your feet. So this one is 42. You're good, you can relax in that position. Now we're gonna go into extension, same exact setup. So you're just gonna, you're gonna lean your head back like you're looking for the ceiling, okay? And this one's 35, 36. So that one's a little bit underneath the normal 45, all right? And then lateral rotation. So what you're gonna do, John, is you're going to move your head, bring your ear towards your right shoulder for me. Norm should be about 45 degrees, firm infill. All right, you can go ahead and do that. Probably gonna guess about 35 degrees range of motion on this one. Trying to feel for the C7, C7 spinous process. Standing arm is in line with the spine. Moving arm is in line with the inion, back of the head. And he's at 35. Then you're gonna go the other way for me to the left. Probably guess about 30, I might guess 30 on this one. He's 27, 28 for this one. All right, and then the last one we have, John, is you're gonna rotate again like you were doing, trying to bring your, but this time what you're gonna do is put your hands kind of on your hips. So what I'm gonna have you do is feel for this bony part projection in your hip. Hold your index finger there for me. And then what I want you to do is kind of rotate like this for me, so you're twisting. Okay, so this norm, so relax for me real quick, sorry, don't do it quite yet. So I'm gonna set up, same exact setup as cervical rotation, should have done this before. But this time what the standing arm is gonna in line with the ASIS, that imaginary line, and then the other moving arm is gonna be in line with the AC joint as he moves into rotation. So 45 degrees is going to be the norm, firm infill. You can go ahead and do it to your left, Jonathan. Try and keep that head straight ahead for me. You can relax for me. This one is 38. All right, go ahead and do this. Move it.
It's the same direction.
I'm sorry, to the right this
Okay.
time. Try to keep it shorter. Keep that head forward, straight ahead.
Okay.
And then relax for me.
Okay.
38 and then 36 for this one. So, last measurement we're going to do is TMJ depression. So, sitting here on a seat. So, patient's going to kind of open up your mouth, open up your mouth without moving the mouth. So just so I can see your teeth. So measurement is going to be in between the top, middle, between the incisors, and the bottom incisor. So close your teeth together for me, and then open them up as far as you can, So he is 37 centimeters. Norm is 35 to 50 millimeters, and the infield is going to be firm.